You've been using Wegovy or Zepbound, Mounjaro or Ozempic for over a month now, and you haven't lost any weight. Why is that? Well, it is perfectly normal. I'll explain. Hi, I'm Vina. I'm a board-certified pharmacist in the US with over 20 years of experience. I'm going to tell you why, after a month or even a couple of months, if you haven't lost any weight on these medications, it's perfectly normal.
If you're already past the first couple months and you've been on one of these GLP-1 medications for at least 3 months after titrating to a target dose and you haven't lost weight, then I'll go over 4 possible reasons for that. But to begin, let's talk about why no weight loss occurred within the first couple months.
The reason why you haven't lost any weight yet after a month or even a couple of months is because the dose is too low. Everyone starts this medication at a very low dose. The dose is considered subtherapeutic. It doesn't work at that dose. There's only one reason that people start at that low dose. It's because your body wouldn't be able to handle it if you started at a higher dose. You would have way too many side effects. You have to get your body used to it slowly. You increase your dose every 4 weeks, as long as you've been tolerating the previous dose. You can go 8 weeks at a particular dose. Even type 2 diabetic patients that are taking the medication to control blood sugar don't get blood sugar control at the starter dose. If you started at a high dose that would cause weight loss, you would probably get severe nausea and you wouldn't be able to continue. There are also other side effects that can occur, like diarrhea or constipation. And yes, I also have seen that 1 or 2% of people that get weight loss from the starter dose, but that is very unlikely. So when do you start seeing weight loss? If you're taking Zepbound or Mounjaro, it is usually when you're at the 5 milligram dose for a while that you start seeing weight loss, and even more weight loss when you increase that dose. Now for Wegovy or Ozempic, you probably won't start seeing weight loss until you reach around the 1 milligram dose. And sometimes it takes a little higher dose than that to start to see the benefit.
If you've been using one of these medications at the target dose for at least 3 months and have not lost at least 5% of your body weight, then there may be other reasons why it's not working for you. A percentage of people actually don't get weight loss from these medicines, even after 3 months at the highest dose. Some of the reasons could be, number 1, you're under a lot of stress. Constant stress can cause the body to have high levels of cortisol. These high levels can lead to belly fat, and unless the cortisol levels go down, it will be difficult to lose belly fat, even with one of these GLP-1 medications. Number 2, you're not getting enough sleep. Constant lack of sleep makes it much more difficult to maintain a healthy weight. The amount of sleep you need is individual, but according to the CDC, most adults need at least 7 hours of sleep per night. Lack of sleep increases your risk for obesity, diabetes, and heart disease. I'll link the CDC reference below. Number 3, you may have another health issue or taking another medication that causes weight gain. These GLP-1 medicines mostly allow you to lose weight because you're eating less. But what if eating too many calories was not the problem in the first place? Your doctor will be able to do tests to see if you have a health issue. One example of this could be low thyroid hormone level. Number 4, you're not exercising. These medicines are intended to be used along with lifestyle changes, including more physical activity. In fact, if you are losing weight on a GLP-1 medication and you don't do any exercise, you're at a big risk for losing muscle mass. That could be very difficult to build up again, especially if you're at an older age. Make sure to add physical activity. If you feel like you're doing everything right, but you're still eating the same amount as before because you still are just as hungry, please know that for unexplained reasons, a small percentage of people simply don't have a decrease in appetite when taking these medications. Please talk to your doctor if this is the case, so you can explore other options, and your doctor can check if you have one of the uncontrolled health issues that you may not be aware of.
If you want to know how these medications work in the body and a comparison of which one is best, you can watch this video next.